Now, it has been 10 months since the start of the Israel-Hamas war, and Israel is fighting another battle. That's the rise in mental health illnesses. There have been a range of estimates as to how many Israelis will develop PTSD, with guesses between 60,000 to 600,000 new cases. And joining us now is Dr. Kamila Forkosh Lavan. She's a licensed practicing psychologist. Kamila, what do we know about how many cases of PTSD there are in Israel today?
So exactly like you said, we so far only have estimates because we really don't know how it's rising all the time. We know that also some of them are for now not reported, and people will be seeking help a little bit later after they come out, out of the state of shock and just pure survival. So right now, any estimate is exactly the same numbers that you know are there. So we really don't know the clear numbers yet, and we're not going to know for a while.
How is the government handling this issue given the mass overload of cases?
It's very, very difficult. Of course, the government is scrambling to do it, and at the same time, we're also scrambling to kind of survive. So I think that while there is a lot also within the army and within the system and within the Kupat Khalim's, of course, to be able to provide services, we know the lines are anyway. There was an overload before, and now the lines are very, very long in order to get service. Also, there's different organizations that are privately funded or partially subsidized by the government that are also offering assistance. Amongst individual psychologists as well, we do what we can in order to offer pro bono services, also discounted fees and whatever we can do. But overall, it's not enough.
Right. I mean, what are the long-term implications of not dealing with these issues head-on, especially, dealing with PTSD when you have so many people who don't necessarily understand or are able to identify that that's what they're going through right now, or maybe dealing with some form of, stress, depression that could then turn into something much larger down the line?
Like anything else, it's a brilliant question, and as always, thank you so much for raising them. Yes, we know that for like anything else, the more it sits there, the longer it festers, the more difficult it is to be taken care of. However, it's very important for our viewers to know that at any time that you realize that you potentially have PTSD, or if you're not even sure, because it's something like usually it's diagnosed, right? But if you see that you or your loved one are exhibiting some maybe out of order, kind of not ordinary type behaviors, maybe they're more frustrated, they have a shorter fuse, whatnot, sleep, don't sleep at all, or sleep a lot. It's a whole bouquet of symptoms, yes. And if you're not sure, do go ask somebody, even just for a discussion as a consultation, to see if you or someone that you love, perhaps are exhibiting something that you need to take care of, and do take care of whenever you can. Like, even if you couldn't take care of it a year ago, do take care of it today, or whenever it is that you have the time to do this. But sooner the better, of course.
Right. All right. Well, I'd like to thank you so much for joining us, Dr. Kamila Forkosh Lavan. Very important, like she said, if you are dealing with any symptoms of PTSD or know anybody in your family who may be, to reach out for assistance. All right.